Hello everyone and welcome. I'm Michael Phillip, your physical therapist, and today's topic is on positioning of the lower extremity following an amputation. So, what is positioning and why is it so important? Positioning is the placement of the operated limb in a specific way in order to prevent contractures, which, if you have not seen my video specifically on contractures and you're watching this, you're going to definitely want to check that one out. A contracture is when you have a tightening of the soft tissues around a joint that advances to such a degree that it starts to restrict normal movement at that joint. When we injure a joint, there are certain positions that just feel better to rest your joint in. Think of when you hit your elbow or your shoulder on something. You're going to find that most people want to bring that arm close to them with their hand at their stomach. With enough time, and you start to add in other factors such as surgery or an amputation, and holding it like this can increase your likelihood of a contracture of your elbow, and you'll be unable to fully straighten it. This is a contracture, and proper positioning would have likely prevented this. Now, back to this video's topic. A typical contracture we see in those with a lower extremity amputation is a flexion contracture of the hip and knee, as well as an external rotation and abduction of the hip. What does this look like? This is where we like to sit in a recliner all day with our knee bent over the edge and our hip in a flexed position and the rest of the operated limb out to the side and slightly turned away so the kneecap faces away from us. So, to prevent this typical contracture pattern in a lower extremity amputee, we then position this patient in a joint neutral position or in the opposite direction of the contracture pattern. So, what does this look like? Well, here would be my top 7 ways to prevent this type of contracture. Number 1, get in the habit of lying flat on your back or flat on your stomach as tolerable for at least 30 minutes several times a day. Number 2, not allowing the lower leg to be bent always over the edge of a chair or say when you're lying down over a pillow. Number 3, when lying in bed, bring the residual limb in line with the body and prevent that kneecap from turning outwards. And number 4, when sitting, rest something underneath the lower leg to keep the knee extended and keep those knees closer together. Number 5, the use of immobilizers, braces, or bandaging may be necessary to keep the limb from moving into positions of a contracture. Number 6, there are also many adaptations to wheelchairs that can be easily added and adjusted to keep the knee into extension. And number 7, not spending too much time sitting. You need to move. Get up and move every single hour. I cannot stress this enough. Prevention of contractures helps with everything from the simplest tasks such as turning over in bed to the complex tasks of walking. Many times, prosthetists cannot even fit you in the new prosthetic limb until the contractures are cleared. So, make sure you start performing positioning early on to allow the best and quickest outcomes. If you have more questions, please speak with your doctor, therapist, or prosthetist, or contact us. I hope you learned some important information today, and it keeps most of you from ever having to deal with a contracture. Till next time, take care. Bye.